And we've brought together a panel of distinguished speakers to discuss how ageism, the human rights of older people, and hate crimes committed against them are at a critical point. The COVID-19 pandemic has served to highlight a gathering storm on the treatment of our oldest and most vulnerable. Not only were they at the greatest risk of losing their lives during the COVID-19 pandemic, many also faced shocking and unprecedented breaches of their human rights. And we've brought together a panel of distinguished speakers to discuss how ageism, the human rights of older people, and hate crimes committed against them are at a critical point. The COVID-19 pandemic has served to highlight a gathering storm on the treatment of our oldest and most vulnerable. Not only were they at the greatest risk of losing their lives during the COVID-19 pandemic, we want to ask if endemic ageism is behind this trend, and we'll hear evidence from our panel on what is wrong, but more importantly, how we might fix it. So to give you a recent example of how the human rights of older people seem to be easily dismissed, I'd like to tell you about a lady who was featured in a newspaper article at the weekend. Now, this is a story of a 93-year-old lady who lives in South London. She's a mother, a grandmother, and a great-grandmother. At 8 o'clock every morning, she goes out for her newspaper, and later in the day, she'll either walk or take a bus to her favourite Tesco store to get the lamb chops that she likes and enjoys to eat. That's about a mile or so away. So she regularly walks in the afternoon as well, and apparently at some speed. And when her great-grandchildren visit her, she'll play with them on the floor. And her recall memory is good, whether that's today, yesterday, last week, or World War II. So knock on the door was the first time this lady knew that the NHS had a plan for her. She answered the door, expecting to see her chiropodist, but instead there stood a man she'd never met, a local nurse who wanted to talk to her about her future healthcare. It turns out he is a frailty nursing practitioner from a nearby hospital. He asked her a lot of questions as part of a frailty review, but what he didn't do was any physical tests, such watching her walk, breathing, memory, that kind of thing. Now, although this 93-year-old does have a number of ailments which are entirely common in a person of her age, she does live independently. And what happened next is completely unacceptable. She was told that if her heart stopped naturally, if it stopped beating naturally, she would not be resuscitated, as this would not be in her best interest. The next day, through the post, came an A4 size poster with a red border with instructions to display it in her home. And it came with a letter which acts as a DNR order: do not attempt to resuscitate. Now, the 5 tests for frailty are unintentional weight loss. Well, this lady is the right weight and she enjoys all her meals. Feelings of exhaustion, well, she is sprightly. Weakness, well, some of that comes with the common ailments in older people. A slow walking speed, no way. And low levels of physical activity. You know, she plays with her great-grandchildren, she walks every day, and she enjoys her life. Now, apparently this is a new NHS initiative that was to replace the dreaded Liverpool pathway, which is end-of-life care. So obviously now we have concerns as to whether this process is any better. And certainly we are not accepting of an unannounced visit without support for an older person. Now, we do accept that there are difficulties and dangers in resuscitating older people, but there is no excuse for overriding an older person's human rights. We also understand that many of us shy away from having that all-important conversation with our families about what we want to happen when we find ourselves in different and difficult situations. And families need time to discuss the implications of a DNAR before making such important decisions. Now, each individual has the right to decide their own future. And that has to come in conjunction with critical information on the consequences of a DNR and should not be imposed against an individual's will. Now, the use of the word frail is very common in medical circles, but it has many connotations for those needing medical attention. So luckily for this lady, her family intervened and she has a planned meeting to discuss her care. However, she is very much worried that the DNAR order is still on her file while she's waiting. Now, at 93, she is a person first and foremost and has rights that entitle her to be treated properly. And there are literally thousands of similar stories out there, not always about DNARs, but about how older people are being treated. And we don't sometimes appreciate that the language that we use daily about older people, but don't really understand, has implications for our care in later life. And the media perceptions of older people, the long-standing myths about who we are and how we live. For example, all retired people are rich and own their home homes. Not true, by the way, but it all adds to that mix. So you'll hear evidence today from our speakers about how these myths and misconceptions drive this negative narrative. Now, there's every possibility we'll be faced with some hard to hear examples of how these can manifest into inhumane and sometimes horrific actions. We hope that we can inform, encourage, and work towards older people being given the value, respect, and the rights due to them as citizens that are still contributing to the economy and the communities in which they live. Now, I'd like to ask Jonathan if he would just give us a brief overview of how we're going to run this and how things will happen. Jonathan?
Hi there, Jonathan Safer, Information Officer for the NPC, not the BBC. We will have each speaker present, and some will have slides, some will not. We'll try and keep the faces on screen as much as possible. And then we will take questions towards the end. Throughout, if you do want to ask anything, please use the Q&A section and we'll try and answer whilst we go along, or perhaps some of the speakers will pick things up. Towards the end, we'll also have a couple of polls. So listen, enjoy, and make some informed decisions on the polls that we have. Okay, Jan, over to you. You're on.
Thanks, Jonathan. And can I just reiterate that people should stay on mute with their microphones, because I know from experience that when you're trying to do a presentation, if you can hear background noises, it puts you off. So thank you very much. I'm going to introduce the panel now. We have with us this morning Holly Harrison-Millane, who is a community organizer for Amnesty International, who recently produced their report on what happened in care homes during COVID. We have Jackie Killeen, Director of Compliance of the Equality and Human Rights Commission. Louise Ansari, Louise Ansari, Communications Director from the Centre for Aging Better. Dr. Hannah Bowes, who's an Associate Professor in Criminal Law at Durham University, and Eddie Lynch, Older People's Commissioner for Northern Ireland. And welcome to all of those. We'll hear from you one by one very shortly. We do have a couple of apologies this morning. Claire Sumner, who is the Director of Policy for the BBC, who we've been engaging with at the moment to look at some of the ways they can help in terms of the perception of older people in the media. And Helen Herclot, who is the Commissioner for Older People in Wales. Now, Helen has another meeting going on alongside this. She did say she would try to catch us at the end. If she does, we'll let her in. Chances are not, but she has asked to work with us in the future. So that's a very good, positive outcome for the NPC. Okay, so now I'm going to ask Holly Harrison-Mullane to begin your presentation. Holly, thank you very much.
Thank you, Jan, and thank you everyone for inviting me here today. So the reason that I'm speaking now is because Amnesty produced a report over the summer, and that was a report that was done by our crisis and tactical research team. They are much more used to investigating war zones. They do a lot of work in Syria. They don't normally focus on the UK, but the situation in our care homes that happened over the summer with coronavirus was so dire and so concerning to them that they focused their time and energy here and did a report based on the UK. And they found that that was a good use of their time, because their report found that the UK government, national agencies, and local level bodies had all taken decisions and adopted policies during the pandemic that have directly violated the human rights of older people who live in care homes in England, notably their right to life, their right to health, and their right to non-discrimination. Those decisions and policies have also impacted the rights of people who live in care homes through their private and family life, and may have violated their right to not be subject to inhuman or degrading treatment. When we were carrying out that report, getting the evidence for all of those big claims, the first thing we did was look at the structure of the care system in England, which the researcher writing the report described as complex. I'm sure that won't be a surprise to any of us who live in England. We looked at some of the long-term challenges facing the sector, and I think it was summarised really well by a quote that we included in the report from the Health Foundation. They said, "The impact of COVID-19 on social care has been shaped, in part, by the underlying structure of the social care system. Measures to support care homes and other services have been implemented in the context of a system that's scarred by decades of political and policy neglect." And we also found some figures about that. So spending per person on adult social care fell by 12% in real terms between 2010-11 and 2018-19, while the number of older people in England who are estimated to have an unmet need for social care has grown to 1.5 million in 2019. And that has huge knock-on consequences for relatives and other informal carers who are all too often left to pick up the slack. And as well as that cost to relatives, there's also the fact that it causes really big market fragility in the care sector. So we've seen a rising number of providers going out of business or handing back contracts. And in some areas of England, the model has already broken down completely and is no longer capable of delivering care to people in need. Part of the reason for that is that local authorities typically pay less for someone's care in a care home than what it actually costs to provide that care, which leads to people who are funding their own care to cross-subsidise those places that are paid for by local authorities. And the reason that this raises big concerns around discrimination is because of the difference between this and the care that people receive in the NHS. So NHS services are provided free at the point of delivery on the basis of UK residency, and there's a single organisational structure. Social care services are means tested and needs assessed, and there's significant local variation in access and performance. there were 18,500 organisations involved in providing or organising adult social care in the sector in 2018, which is huge and obviously causes big coordination problems. And we knew about those coordination problems before the start of the pandemic. One of the things that we looked at for this report was something that the government did called Exercise Cygnus, which happened in 2016. And it was basically a planning exercise for government bodies to see how they would respond if there was an influenza pandemic, which is obviously slightly different to coronavirus, but had a lot of relevant lessons. So Martin Green, the chief executive of Care England, said that there was no recognition in either the planning process that happened in 2016 or indeed at the very start of the current pandemic that the people most at risk were in care homes. And so we should have prioritised care homes, both in the planning that went on for 2016 and in the planning that went on at the start of this pandemic. And I think that's quite a dry quote, but what it's really telling you there is that there was no excuse for what happened at the start of the pandemic, because the government knew in advance that there would be problems with care homes and that people living there would face particular risks. And so they needed to take particular care, but they didn't do that with tragic consequences. So one of the other things we did in the report was to provide a bit of a timeline around decisions that should have been taken differently. So from the very start of the pandemic, we knew that older people were more at risk. It was noted in February by one of the different scientific advisory groups for the government. On the 11th of March, the World Health Organization said that all countries should be implementing testing, tracing, and isolating systems. But the very next day, the UK stopped doing community testing for coronavirus. On the 13th of March, that was the first time the UK government released guidance specific to care homes, which is a whole month after they'd been told that there would be specific problems with care homes. But that specific guidance didn't make things better, it made it worse. It told staff not to use PPE when they were talking and being close to people who are asymptomatic, even though at that point we knew that asymptomatic transmission could happen with this virus. And relatives told us that later on, this understandably led to a lot of care home staff underestimating how important PPE was for keeping their homes safe. And we heard a lot of stories about staff moving between different rooms and just other practices that really could have been clamped down by that guidance, but just weren't. One of the most important ones is regular testing for care home staff and residents. It's been urgently called for by the sector since March, but by the time we'd finished this report in September, it still wasn't in place. So contrast that with measures taken to boost the NHS capacity. Care home managers and staff told us about a complete breakdown of the systems in care homes in the first 6 weeks of the pandemic. They talked about waiting to receive guidance, struggling to access adequate amounts of PPE, having no access to testing despite having to manage patients who'd been urgently discharged from hospitals, including those infected with COVID-19. And those deficits put many of the most vulnerable to the virus at great risk, as well as endangering those staff. And in doing so, that was what violated care home residents' right to life, right to health, and right to non-discrimination. And we heard a lot of stories about how this directly impacted care homes. So there was one story that a care home manager told us in the north of England. They said, we had COVID-19 in the care home, 2 cases, 1 death in the home and 1 death in the hospital. In our opinion, both came from individuals going into NHS facilities and coming back. A care home volunteer told us, I think the reason our home was hit so late and protected for so long was because we were full. There was no space for people being discharged from hospital. There was a survey of care home nurses that happened between March and May by the Queen's Nursing Institute. 21% that their home took people discharged from hospital with COVID-19, and 43% said their home accepted people whose status was unknown. So in the NHS, when people who are known to have coronavirus are being treated, the staff have access to PPE, there's guidance in place about how much PPE needs to be worn and about isolation procedures. But care homes and care home managers were being told that they needed to accommodate people who were positive for care home 19 without being given proper safety or guidance, or anyone checking that they had the ability to do infection control properly within their homes. And where care home managers tried to resist this happening and tried to tell hospitals that they couldn't look after people suffering from COVID-19 safely, they faced huge pushback from the NHS and from local authorities. We found one case in Durham where the council had attempted to make funding for care homes conditional on them agreeing to accept COVID-19 positive patients, which was not required of the council by central government. And after it was exposed, the council took away that conditionality and stopped asking care homes to sign this contract with them. But when we later followed it up, the care homes who had taken the deal and had signed up to this contract were some of the worst hit care homes in the area by the virus. So the other thing, as well as this issue with discharging patients and around no statutory body agreeing to check that care homes are safe, was we found a lot of stories similar to the one that Jan spoke about just now of inappropriate use of DNRs. So a DNR is a type of order that says that if someone has a heart attack or other type of medical emergency, no one will attempt that kind of invasive resuscitation. And we found evidence that in some local authority areas, there was blanket use of DNRs in care homes, which is completely illegal. Any kind of do not resuscitate order needs to be decided on an individual basis, based on the circumstances of the person who it applies to, in discussion with them and their family. It can't be applied to everyone based on categories, because that is discrimination based on age. It has to be about the individual circumstances of each person, which is obviously extremely concerning. The other thing that our report focused on, alongside the risk of getting the virus and the direct health risks of the virus, was the impact of lockdown on care homes. We found a lot of evidence that care homes were basically putting in blanket bans on visitation that extended long after they were necessary and that had really severe impacts on their residents. There are a lot of specific challenges of remote communications for people who live in care homes. We heard about people who are hard of hearing and people with dementia who can't communicate effectively by video call or through screens, being told that that would be their only contact with the outside world. And the other thing that we found that was extremely worrying was guidance telling staff to supervise visits with relatives to ensure social distancing. This is a violation of the right to privacy, and it's also got practical reasons for being extremely dangerous. The Care Quality Commission refers to relatives as their eyes and ears on the ground, so that they know what's going on in care homes, so that they know when they need to do inspections, so that they know where and when abuse is happening. But effectively what we saw over the summer was care homes went completely dark to the outside world. There weren't those visits. There weren't residents who could check to make sure that everything was going properly in those care homes. And when residents were allowed to have contact with their families, it was all watched over by staff, which is obviously terrible for their ability to whistle blow or speak out about anything happening there. And the other effect that we found from that prolonged isolation was serious and possibly permanent deterioration of the health situations, especially people with dementia. We found some really distressing quotes about how it had been affecting people. One of the quotes we found from a resident was that life just doesn't feel worth living without contact with the outside world. And there's obviously very good health reasons that those limits were put in place at first, but it's been a very long time since this virus was discovered, and we know what would allow visits to take place. It's regular testing, and for relatives to be treated a lot more like care home staff, because really that's just recognizing the fact that relatives, when they're coming into care homes, are also doing something essential, often as essential as what the staff are doing when they're coming into care homes. And so they should be treated that way as well. And I'll just finish by quickly summarising some of our recommendations from the report. So the first one was for a fully independent public inquiry that would basically give a big release of information about what happened at the start of the pandemic, so that we can make sure that those same mistakes aren't repeated over the winter. We did ask for one much earlier than has happened, and we haven't seen that, which has been a huge frustration. And it has led to us having some really serious concerns about mistakes being repeated. We saw some evidence more recently, after this report was published, that local authorities were yet again trying to block book beds in care homes so that they could discharge people from hospitals directly into care homes, which is, we know, a huge cause of the disaster that happened earlier in the year. The second demand that we had for the government was a complete review of all do not resuscitate orders that were put on to people living in care homes during the pandemic. That was much more successful. The government have agreed to that review, and we've got evidence that that's starting to happen, which is brilliant. But also, it never should have happened in the first place. We shouldn't need to be asking for this. And then the third thing that we're calling for was regular testing for people in care homes and their families, so that those visits can happen again. And we've seen a pilot program of that, which has been successful. And we've also seen some promises to roll that out more widely. But obviously that hasn't happened yet. It's a slow process. And we plan to keep asking the government about this and keep putting pressure on until we've got a process that works and that is respecting to everyone's rights.
Okay, thank you very much, Hannah. I've got a couple of questions here. One is that I take it this report just applies to England, is that true? Yeah.
Yeah, so we did focus on the situation in England. There are obviously slightly different dynamics in Scotland and Wales, and we would appreciate more research in that area of what's going on there.
Yeah. In terms of where we want to go from here, Holly, is there some area that we can support Amnesty in terms of getting a full investigation?
Yeah, so the more organisations that call for this, the more pressure there is. We've written to a lot of ministers. We've had some trouble getting them to respond to us as well, which has been a real shame. But we know that there's interest in this. We know that there's momentum on this. We know that a lot of MPs who aren't normally so interested in speaking to Amnesty have been interested in speaking to us about this, which is brilliant. So I'd encourage everyone to carry on lobbying their MPs and to carry on using organisations like this and any other organisations that you're part of to lobby MPs and keep talking about this.
Yeah, thank you. And the second question I've got is that it's a comment actually, where NHS staff often say to people that a DNR is a medical decision. Is that a correct assumption, or is that correct information, I should say?
Well, it's about what they mean when they say it's a medical decision, right? I mean, are they saying that as an attempt to say that it's a decision that should be made by a doctor and that, you know, the person who's affected by it doesn't get a say? You know, just like if I went to the GP with pain, I probably wouldn't go in there and sort of talk too much about exactly what kind of medication it is. It's right for the doctor to decide what they're going to prescribe me. This isn't, a DNR is not that type of decision. A DNR is the type of decision where the person affected needs to be actively involved, needs to understand what's going on, and there needs to be proper consultation. And the other thing about that idea of the phrase of it being a medical decision is that it needs to be an individual decision, right? The problem with what we found over the summer was that there were certain areas and certain care homes where these notes were being added to people's files just as a decision of everyone over a certain age or everyone who lives in a specific care home will have this note put on their file. That's not how medical decisions should be made. Medical decisions need to be made based on the individual health situation of the person that they're being made about. And that wasn't what we saw happening.
Thank you very much, Holly. There'll be some more questions when everybody's done their presentation towards the end of the seminar. So thank you very much for now. Thank you. Now I'd like to introduce you to Jackie Colleen, who's Director of Compliance of Equality and Human Rights Commission. Morning, Jackie. We understand that the Equality 2010 Act does have age as a protected characteristic, but obviously the hate crime legislation doesn't. So we'll be interested to hear what you think about age and ageism. So thank you very much. If you could start your presentation now.
Thanks very much, Jan. Good morning, everybody. Lovely to be joining you today. Thank you very much for the invitation to take part in your discussion today. I have just a few slides. I hope they won't be too onerous, and I'm not sure who is operating the slide deck, but I'll just ask to move forward at the right moment if that's okay. That's perfect. Thank you. So I just wanted to say a few words, first of all, about the Commission in case anybody hasn't really come across us before, and a reminder of what we exist to do, particularly in these very challenging times. We are here to protect and promote equality and human rights in Great Britain. Northern Ireland has its own legislation and its own infrastructure. We're here to stand up for freedom, for compassion, and for justice. And we have a responsibility to promote and uphold and enforce the equality and human rights ideals and laws that are there to protect us all and that have been very hard won over a very long time. And I suppose I would say that myself and my colleagues are driven by the belief that if everyone gets a fair chance in life, we all thrive. This year marks a decade since the Equality Act of 2010 came into force in Britain, and 20 years since the Human Rights Act of 1998 came into effect. So it should have been a landmark year for equality and human rights. It's been a fairly monumental year for those things, but in a different way to what we could ever have expected. Together, these two acts provide a framework of fundamental protections for everybody, and arguably they have never been more important. We have a responsibility for providing guidance to help people comply with equality law and human rights obligations. We call people who have those obligations duty bearers, and we also have a responsibility to help enforce the Equality Act. I'm going to talk briefly about some of the equality and human rights issues relating to older people that we have been addressing this year, particularly in relation to the coronavirus and pandemic and the provision of care, but I'm also going to mention one or two other things as well, if that's okay. So we have at all times an important role to play as an information provider, as a contributor to public policy, as an evaluator of how effective that public policy is, as an enforcer of the legislation, and as a catalyst for change. From the beginning of the pandemic, and indeed then the lockdown, as emergency legislation was debated in the Parliament, we have been consistently raising our concerns and the profile of equality and human rights issues with those in power across the three nations of Great Britain, as well as with the organisations who were in the difficult position of responding in real time to different aspects of the pandemic. So we have engaged with parliaments and governments, but also with regulators, inspectors, inspectorates, ombudsman and others. We've had a dialogue with the UK and the devolved governments, and that's continued throughout. And we have submitted quite substantial information to select committee consultations considering different aspects of the pandemic response. And we've also monitored the queries and the issues raised by a range of our stakeholders. We are calling and continue to call on national and local governments, on regulators and on care providers to ensure that equality and human rights laws are at the heart of decision making. We have concerns that this hasn't always been the case. We know that these are challenging times, but when difficult decisions must be made, human rights laws are an essential and a helpful framework to guide those difficult decisions and to protect people and protect people's rights. We have emphasized, and we would really want to continue to emphasize, that these are safeguards and they are enablers, and they are not an extra burden or an afterthought that people consider at the end. And we have emphasized that throughout, not just in relation to what has happened in care, but in other sectors as well. And we have seen that risk that in times of crisis, those issues are considered at the end rather than at the outset. We think that the current crisis has raised very serious questions about how we value the rights of older people in our society. As Holly has said, and we were also engaged with the Amnesty report, and we've drawn on that in some of our evidence as well to different submissions. We've seen the discharge, sorry, if you could go back to the previous slide. Thank you. We've seen the discharge of COVID positive older people from hospitals into care homes. We have seen examples of inappropriate blanket healthcare decisions on issues such as the DNAR notices. We've seen lack of sufficient PPE for care workers, and we have seen the exclusion of care home deaths from official COVID-19 death rates at the beginning of the pandemic, all of which point to the rights of older people not being thought of as a priority or as enough of a priority at the outset. We know that similar trends have been replicated across the world, with the UN Secretary General Antonio Guterres releasing a statement in May emphasizing that older people have the same rights to life and health as everyone else. It was quite a shock that he felt he had to issue such a statement, but telling that he did. In October, we produced a report called How Coronavirus Has Affected Equality and Human Rights. This is part of our ongoing monitoring of how fair Britain is and how well equality and human rights are doing in society. This was published in October, and it brings together data to shine a spotlight on the most pressing equality and human rights issues that need to be addressed, including for people accessing social care. And I just wanted to briefly mention a couple of the findings from that. So we have found, monitoring all the data, that older people, ethnic minorities, and some disabled people, especially those in care homes, have been disproportionately impacted in the pandemic. We've seen particular pressures on social care, and that these have threatened the financial resilience of the sector, echoing what Holly has said, potentially impacting on those who use it and those who work in it. This in turn has led to increased reliance on unpaid carers, many of whom are more likely to be women, and many of whom are older people themselves, and many of whom are also disabled people themselves. More broadly, we have seen measures to address the pandemic impact really very significantly on older people and disabled people, and that these have exacerbated existing inequalities. So, for example, even before the pandemic, we know that 1 in 5 older people and disabled people didn't access the internet, and therefore have, over the course of the lockdown, potentially become further excluded from those services as they increasingly moved online. And we've also noted an impact on access to healthcare. So both routine healthcare, GP services, dental and optical services, as well as more life-limiting and life-threatening conditions, and that this has potentially contributed to a deterioration in health and well-being, and therefore in quality of life. So if I could move to the next slide, please. I also wanted to mention that some of the, in a little bit more detail, some of the broader issues that we have been acting on. So the Equality Act requires that all service providers make reasonable adjustments to enable somebody who has a disability to access their goods and services. We were very concerned to hear that some older people and disabled people were struggling to access food and essential supplies as the restrictions were brought into being. Particularly in shops, as panic buying took hold and as supermarkets and others began to introduce their own measures. We initially wrote to the British Retail Consortium and to DEFRA, and we subsequently produced easy to understand guidance to ensure that all retailers were fully aware of their responsibilities to make reasonable adjustments. So we have produced this guidance, which we know now has been used in training by a number of the larger retail groups and some of the independent retail groups as well. So I just wanted to note that these impacts have been across society, not just in care, and we have been very mindful of the cumulative impact of that. If you would move to the next slide, please. The report that I mentioned and our additional briefing that we produced for Parliament on equality and human rights in residential care in England during the coronavirus was published in October. In it, we have made some very strong recommendations for government and for those commissioning social care and for those inspecting care and for care home operators. And those recommendations include an urgent review into the experience in care homes during the pandemic. We also have called upon decision makers to demonstrate how they have considered on an ongoing basis the impact of their decisions on care home residents and people with different protected characteristics. And that is a requirement that hasn't always been visibly met. We have made the recommendation that care home residents should have full and equal access to all necessary healthcare, including GP services and hospital treatment. And we note that urgent steps should be taken to ensure that older people and disabled people, as well as their representative organisations where appropriate, are involved in and consulted on decisions about access to healthcare and treatment, both at an individual level and also at the national policy level. You've already discussed do not resuscitate notices. Yes, we noted that they were wrongly applied to people's care plans, and we called for them to be removed. We also called for the capacity to test residents, staff and loved ones, and that this must be increased to protect older people and allow them to see their families. We noted that blanket restrictions on visits should be amended to ensure that all decisions are made following individual risk assessments. And I think we couldn't emphasize that strongly enough, that it is individual risk assessments that need to take priority. And we noted that the right to independent living should be incorporated into domestic law. This is an ongoing call of ours to protect the human rights of disabled people during and following the pandemic. I think throughout the pandemic, we have seen challenges for many of the people who have been dealing in the front line of the emergency, and we have seen that there has been a kind of balancing of risks. We would say that that balancing of risks needs to be mirrored also by a consideration and balancing of rights as well. So we are working with government, with regulators, with commissioners and with care providers now to ensure that these recommendations are taken forward. And we're also open to considering using our enforcement powers to drive change. And I noted that the CQC interim report on the DNAR notices was published this morning, and in it does quote our briefing for Parliament, noting that the right to life is non-derogable, which means that it must be maintained even in times of emergency, and that public authorities have positive obligations to protect life. And we were pleased to see that, and I think that needs to be at the heart of decision making as we move forward. If you could move to my last slide, please. Challenging ageism. I know that we'll hear in more detail from the Centre for Ageing Better, and we were very interested in their recent report analysing the way that ageing and later life are spoken about in politics, in the media, in advertising and the charity sector, showing that the language around ageing is often quite negative and is associated with decline and with ill health, and that older people are commonly portrayed in a sort of undifferentiated way as frail, as vulnerable and as dependent. We recognise that, and that also echoes what we have seen and been concerned about throughout the pandemic, as well as more broadly. we have noted the Centre for Ageing Better's conclusions that these ways of talking about ageing and later life underpin some of the issues that we've seen during the pandemic, with older people being treated sort of as a homogenous group, really, who are vulnerable and frail and a problem to be managed rather than citizens of equal value. And this has been an issue of concern for us. A number of our stakeholders have emphasised their concerns, which we share, about the link between ageism and society's response in general to COVID-19. But I think there is also the prospect that the pandemic could provide some opportunity for us to challenge ageism in society. For example, one of the things that Age UK, I think, have highlighted is that due to the benefits of increased intergenerational contact through digital platforms such as Zoom, as we are on today, that can help debunk myths around older age. Our position is that we believe ageism needs to be challenged, and we are now considering how we can help to change the too often negative narrative around ageing. Equality and human rights legislation rightly protects all of us, but many of the decisions in the coronavirus response raise really serious questions for us about the value that we place on older people and disabled people's lives and their rights. I would say that now is a time for us as a society to show how much we value everyone's rights. And in conclusion, I think there's been very much talk of building back better, and our vision would be of a society that leaves the pandemic as a more rather than less equal society, and that now, as we have all witnessed on really quite a colossal scale, what the deprivation of human rights looks like, we work harder to value, uphold, and place them at the centre of recovery. And we would be pushing for equality and human rights to be designed in at the outset of recovery, and any reform that takes place, rather than considered as an afterthought. Jan, thank you. That's me.
Thank you very much, Jackie. We'd very much love to be in touch with you about how, as an organisation of older people with varying degrees of abilities and lives as volunteers and all kinds of other things, to actually work with you on how organisations like ours can actually begin to challenge, you know, how the legislation that exists, that you are clearly so working hard, you know, to implement, how we can help that, and how, you know, we can perhaps change the narrative around older people, which takes a long time because a lot of legislation has the wrong kind of language. And as we know, legislation is slow to be reformed, but that doesn't mean that we can't work together in the meantime and hopefully, you know, make some drastic changes, even if it's in a small way, that mean that older people can get some recognition for the value that they still have in communities. So thank you very much. I wonder, and I've had a question, it might not be for you to answer, it might be for later on. But somebody's asked me, do you have any statistics around whether care homes that are privately owned and care homes that are local authority run, is there any difference in the type of care quality and how they treated COVID?
It's a really good question, Jan. It was something that was, I don't have statistics to hand. I would say I can look and see what we now have. It was something that was flagged with us quite early on, and in the first couple of months of the pandemic, and we were trying to monitor whether that whether we could note that there was a general conclusion to draw. I think we came to a position at the time that it was very variable, and that there were some practices that we saw that smaller care homes, for example, were better able to respond in some ways, for example, around putting in flexibilities around visiting, and that some kinds of care homes or groups of care home operators had different routes to access around things like PPE. So I think it's probably a very mixed picture overall, and there may well be different benefits that took effect and different challenges that took effect across a range of issues in the different sectors. I can go and check whether we have statistics, but I know that when we were looking at it in the summer, it was quite difficult to draw a hard and fast conclusion on that.
Right, okay, thank you. I mean, it was a hard question thrown at you right at the end. I want to thank Derek from Wales, our NPC Wales chair, who's put a lot in the chat about how the Commissioner for Older People in Wales dealt with it, which is quite a model, I think, for us to kind of push towards for, you know, the English government. And obviously we're pushing for our own Commissioner for Older People. So that's quite helpful. And I'm sure that you do work with both commissioners in Wales and Northern Ireland.
Certainly with Wales, and we issued a number of joint statements with Helena early throughout the course of the pandemic, and we're continuing to work with her office as we move forward. I would just say that we are still very engaged on social care as a priority. So as we kind of move forward through these evolving stages of the pandemic, and hopefully beyond, we are looking at a number of things in closer detail, and we are considering how we might use our powers in them. So one thing, it's not specifically this, but it will have a bearing on it. We have launched an inquiry into the employment experience of people from ethnic minorities in the lowest paid roles in health and social care settings. That has just started, and we'll shortly be issuing our call for evidence on that. So we're looking at the employment experience and outcomes of those health and social care workers who have been on the front line and who often come from ethnic minority communities. We're also looking at other issues that have been thrown up as potentially, you know, having had their inequality exacerbated by the care home or revealed the pandemic, or revealed more starkly. So for example, we're looking at decision making around access to care needs assessments, those kinds of issues as well. And we're continuing to consider how we can best use our powers to drive improvements here as we move forward.
Well, thank you very much, Jackie. There'll probably be some more questions at the end of all the presentations, so I'll come back to you. Thank you so much. I'd like now to call on Louise Ansari, who is the Communications Director for the Centre for Ageing Better. Louise, if you'd like to begin your presentation, please. Thank you very much.
Thank you, Jan, and thanks so much for inviting us, for inviting me today. Centre for Better Ageing. I think we should change our name because everybody calls us the Centre for Better Ageing. Centre for Ageing Better. Anyway, so if you've not heard of us before, Centre for Ageing Better is a charitable foundation, and our mission is that everybody should be able to enjoy later life. We work to change policy and practice across 4 main areas, and that includes health, work, community, and housing. So I'm going to touch on all of those areas and try and address my comments to the theme of ageism. And the first thing I'm going to do is just do a couple of minutes on a report that we issued recently, our kind of flagship report that we do every year, the State of Ageing. And it's mainly in England, but some of the stats are UK wide. And if you go onto our website, you'll see the full report and the graphics there, and you'll be able to see which refer to the whole of the UK and which refer to England. So the State of Ageing is pretty much a snapshot of what it's like to be over 50 in England. And we have kind of analysed the data from lots of different sources, including the ONS and the English Longitudinal Study on Ageing and other sources, to give a picture of what life is like now for people in later life across work, housing, health and community. And we've also looked to see if there are trends and basically see what's happening. You know, things getting better or things getting worse. Now, and we've also obviously looked at the impact of the pandemic on our later lives. So the overarching picture is, and the pandemic has sort of thrown this into sharp relief, and Jackie started to mention it in her last comment, is about the inequality suffered by people in later life. So, and in how we all age very differently. And if you look at something really basic like life expectancy and healthy life expectancy in Britain, so progress on improving life expectancy was stalling. So we were getting these huge increases in life expectancy year on year, and they've started to slow down until the increases have almost stopped for the poorest people. So actually poorer people are starting to, those huge increases that have been going on throughout the 20th and the 21st century have started to stall. And in terms of disability-free life expectancy, so that's the number of years you can expect to have without a disability or a limiting health condition, are actually going backwards, which is shameful in a country as rich as ours. So if you were a baby girl born in 2010, you could expect to live to 65 without a disability or a limiting health condition. If you're a baby girl born in 2018, you can only expect to live to 62 without a disability or a limiting health condition. So the number of years people live without a limiting illness has actually gone into reverse in this country. And you also see huge differentials in terms of wealth. And many of you on the call will know this. So women in the wealthiest part of the country will live 16 years longer in good health than women in the poorest parts of the country. And what's happening, and COVID shone a really shocking spotlight on the kinds of inequalities that we've got with the poorer older people and poorer BME people basically dying first and in large numbers. So we need a real focus on prevention and support with people with health conditions in the poorest communities in Britain. If we turn to housing, there's around 2 million people aged 55 or over who are living in a home that endangers their health. And those kind of hazards, so things like mold and damp, cold, poor heating, trip hazards, can be fixed. It would take about £4 billion, which used to sound like a lot of money, but obviously this current government has been dispersing money recently. To have that, we need that level of investment support for a major upgrade and refurbishment of our housing stock, which is the oldest housing in Europe. And this huge number of older people are living in that poor housing stock, and that is being extremely detrimental to their health. So if you live in a cold and damp house, you're more likely to have a respiratory condition and more likely to be susceptible to diseases like COVID. So this is, in terms of the wider determinants of health, it's absolutely scandalous that millions of older people are living in housing that doesn't actually take much money to refurbish. And that needs to be done. Many older people cannot afford to do that. And then when you think about new homes, they all need to be built to a higher standard of accessibility. Now, actually, a consultation on the building regulations has just closed, and we're really hopeful that this government will mandate a higher level of accessibility for all new housing, and that we'll hear about that hopefully in the results of that in March or April. And if we look at employment, this has been actually quite a positive picture over the last few years in terms of over 50s in work. You've got 1 in 3 workers are over 50 now. But even pre-COVID, there were about 800,000 over 50s who wanted to be in work and couldn't. And we know that ageism is a significant reason for this. And we would love to work more with the Equalities and Human Rights Commission to investigate ageism at the point of recruitment, and also ageism in terms of progression and other areas in work, because there's clearly discrimination going on. But certainly it's perceived very heavily amongst people over 50 who are trying to get jobs and are not able to. So then we have COVID. which we really fear is going to bring about a long-term unemployment crisis for over 50s. 2.7 million over 50s have been furloughed during COVID, and they are the most likely to find it difficult to get back into work once they've been made redundant. And this is, as I say, is in part due to ageism. So the government, they've made announcements about the restart scheme, and we've been saying very heavily and talking to ministers about it, who have been quite receptive, that the restart scheme needs to include tailored job support for older people to get back into work, as well as younger people. And the narrative needs to be changed. It's not just about young people need to get back into work. Everybody who needs a job and wants a job should be supported to get back into work in order that their financial security is propped up, particularly given the rise in the state pension age. So in communities, the sort of final area, actually a much more positive story. Everybody's seen this surge of community activity, which has been great. Very large numbers of older people, not just at the receiving end of that kind of care and support, but actually giving the care and support as well, volunteering in their communities and giving that support. But as one of the previous speakers said, there is this problem with lumping all older people together as vulnerable, as frail, and the language that was used during COVID has been extremely ageist. So I'm going to come on to that language point, and Jackie kind of gave a trailer to what we said in our report. So I'm going to go back to basics for a second. So what is ageism? You know, how do you define it? Lots of you will know this, but that phrase was coined by a gerontologist called Robert Butler in 1969, I think it was. And he defined it as bias from one age group towards another. So that obviously could also mean, you know, bias from any age group, but older people towards younger people as well. So ageism has got the potential to go lots of different ways. And it's a combination of how we think about age. So that means what stereotypes we're putting into play, how we feel about age. So that's our kind of innate prejudices, and then how we act. So with the potential for discrimination in those behaviours. So it's kind of think, feel, and act. But obviously that ageism doesn't just affect how we think about other older people. It impacts on how we feel about ourselves as we grow older and our own aging process. And that can lead to limiting behaviours, self-limiting behaviours. So I'm too old for that kind of thing, which is really damaging for individuals. And there is one study that actually shows that if you don't have a positive view of aging, that can take 7.5 years off your life. It's that famous Becker-Levy study in the early 2000s, because you don't seek healthcare yourself. So there's a real problem, not just with ageism directed towards older people, but the ageism that we potentially direct against ourselves. And we basically have looked at trying to kind of reframe this idea that aging is a wholly negative experience and that everybody experiences aging in the same way. We know that society's dominant narratives about aging are negative. It's about physical and cognitive decline. All older people are characterised as frail, vulnerable, dependent. And because of that, the fact that society is aging, there's this demographic change going on, means that vulnerability has been framed as an economic burden for society. And this then translates potentially into a source of intergenerational unfairness and at worst intergenerational conflict. Now, by 2040, 1 in 4 of us will be over 65. That's a lot of people. Quarter of us over 65, with over a third of us over 50. We don't want, as a society, to live with this overwhelmingly negative and ageist attitude. It's deeply damaging to the fabric of society. So the research we've done on language which underpins those attitudes and the feelings and behaviours, we've done with the University of Kent and a couple of organisations called Equally Ours and Comres. We've looked at language across the media, marketing and advertising, charities, the NHS, the government, because they've all got a really important role in reinforcing narratives in later life and therefore influencing how we think, feel and act. So I'm going to tell you what we found in some of those areas, and please do go on our website and read the full report. I don't think you're going to be surprised by this, but we've got some really specific recommendations for each of those sectors. So in government, ageing is primarily seen as a cost to the public purse. And obviously social care is often referred to without the acknowledgement that social care is used by people of all ages. There are some signs though that this kind of dominant narrative of cost is turning around. So you've got the Ageing Society Grand Challenge, for example, which is trying to promote positive innovation around what business can do to start serving older people and the older market better. But we say to government, you need to avoid this fatalistic narrative that it's a crisis all the time, and you should not use age as a proxy for wealth, because as Jan said in her opening remarks, not all older people are wealthy, and even if older people do have a bigger share of housing wealth or housing assets, doesn't necessarily mean that their income is high or they can even actually repair homes. And actually we've got about 1.9 million over 65s who are living in relative poverty. So government, in their narrative and their way of thinking, need to recognise the diversity of later life, and that should be reflected in their policies. Now, if you look at the news media, they go so quickly to the stereotypes, don't they, about older age, in the imagery as well. You know, the wrinkly hands, which we despair about constantly, as the single picture that seems to represent several million people. You know, you're either lonely, you're sitting in a chair on your own, staring bleakly out of the window, or you're a hero, you're skydiving. You know, you have a go, granny beating off a mucker. I mean, those two stereotypes are very far away from the reality and the diversity, obviously, of all of us. The broadsheets are more likely to talk about health and social care, but they have been, we've noticed how much they've been stoking intergenerational tension recently. So headline in The Independent recently, baby boomers and millennials seem at constant loggerheads. You see that quite a lot. I've seen it in The Guardian as well a few times, and it just simply isn't true, because when you ask both older people and younger people, they say, actually, no, we really care about each other. We care about other generations, and we're not at loggerheads. You know, there is a social contract between us, and these are people in our families. So the media do tend to stoke that idea. And then you've got social media. Now, this is where some of the nastiest and insulting and hateful language appears. You know, not just kind of old fart and old hag and grumpy old man, but some really nasty stuff. And some of it, actually, you've got some apparently funny kind of stuff like, my nan could do that better. And lots of joking stuff, although underneath the jokes, obviously, is some serious ageism going on. But there is potential in social media, because that is also a space where older people can redefine themselves, and quite often people are doing that and putting some serious challenge out there. But we think across media, all the different types of media, the editor's code should include age as a protected characteristic, in the same way that it does with gender and race. Again, it needs to capture the diversity of later life, and social media companies need to ban and challenge hate speech where it appears. So looking at advertising, what we saw in advertising were kind of three types of narrative. So the first is tragedy, you know, again, the lonely person sitting in a chair. The second is glamour. So once you use those anti-aging products, you're going to look fantastic, you look glamorous. And the third is slightly more straightforward. So marketing financial products or holiday products, pretty much always captioned with a happy white heterosexual couple holding hands. We want the Advertising Standards Authority to set standards on age in the way that they have done quite successfully with gender and race, and we've got a meeting with them coming up actually, so we're hopeful they'll move on that. We want general products to be marketed to all ages. because people in later life also buy washing machines and cars and general products, and yet they are not marketed to. And the people who work in the advertising industry are by and large under 40. So we need people in the advertising industry to change their understanding, have a different narrative, understand the market better, and stop being ageist. And stock photography needs to capture the diversity of later life as well. So the final area we looked at were charities, which obviously we're a charity, we want to learn from this as well. Now, charities are often really positive in supporting and caring in their use of language, which is fantastic. But loneliness dominates in terms of charity narratives, particularly in fundraising. And many of you might have seen the ads from the big charities at the moment, their Christmas campaigns. Really sad pictures and narratives about lonely older people. Now, if people look at the Community Life survey, they will see that actually loneliness is more prevalent in 16 to 24-year-olds than it is in people in later life. And loneliness is a state that is a natural state in some ways that we'll travel in and out of throughout the life course. And yet some charities are characterising all older people as lonely and vulnerable. And we think that harms not only social perception of older people, but ourselves. That we will internalise, when you're older, you're going to be lonely. That's it. You can't change that. It's inevitable. And so we think that charities should emphasise the good as much as the bad and avoid stereotypes in their fundraising narratives. So in conclusion, the negative stereotypes and framing of older age are just pervasive across society, across the language used, across imagery, and across lots of different sectors. We've got a lot of work to do to change this. It's really damaging to the social fabric. It makes us feel bad about ourselves, and we need to move towards a much more realistic narrative that recognises the opportunities as well as the challenges and the diversity of later life. Thanks, Jan.
Thank you, Louise. Just to let you know, the NPC did respond to the government consultation on accessibility. So through our own housing working party, who are the experts within NPC. So we're as hopeful as you are that they take some notice. I'm picking up from your presentation, maybe it's wrong, maybe I need to clarify it with you because we need to be clear. Is it the case that political decisions might be made on ageism, on factors of age? We know that the government has itself, even in the House of Commons, used ageist language. And I was just wondering how prevalent that might be in shifting into the decision making about services for older people against services for younger people, or the whole of society. What do you think?
I certainly think there is a tendency. If you look at something like, look at the Restart programme, or look at back to work programmes. They've kind of failed at older people, really. They've not really worked for over 50s. And when you hear, particularly recently, when you hear government talk about those kind of programmes, they almost exclusively talk about younger people. And then we all have to pile in and say, look, here's the evidence about how it's affecting older people as well. Or if you hear, let's say, strategy to reduce obesity in Britain, the government thinks, okay, childhood, let's have things which will talk about childhood obesity, because we probably think that voters are going to respond better if we refer to childhood. Whereas the section of the population where obesity is growing and where we're becoming fatter and iller is in the older population, particularly over 75s and 85s, which is again linked to COVID. So I think the government will sometimes perhaps think that their policies will be better received if they are focusing on younger people. But I think I've seen a change there, to be honest. I think if you present the evidence to ministers and civil servants, as we've tried to do in an incredibly proactive way, as the NPC and other organisations have done, they will listen, and we find them very receptive to hearing the evidence and the impact on older people. So I wouldn't say it's blanket, and I feel it is turning around. But I think in the past that certainly may have been a factor.
Mm-hmm. Yeah, thank you, Louise. I know you've got to leave at 12:30. If some questions come up that we would normally ask, in the roundup after presentations, that I think you might be able to answer, is it okay if we email them to you?
Please do, be delighted to.
But thank you for giving us your time today, and thank you very much. Okay, we are now going to invite Dr. Hannah Bowes to do her presentation. Hannah is an associate professor in criminal law at Durham University. So Hannah, if you please.
Thank you, and thanks very much for inviting me. I'm really pleased that my presentation is following on from the fantastic ones we've already had this morning, which have fortunately touched on topics that are relevant to mine and largely have been of a similar perspective to me, actually. So that's always a nice starting point when you're talking about this type of issue. So I'm going to attempt in a very short period of time, so 10 minutes or so, to talk you through some of the proposals to criminalising violence and abuse against older people, and why I do not think that more law is the answer to address some of the issues that we see in relation to victimisation of older adults. My contact details are on the front slide there. If anybody wants to get in touch with me afterwards, I'm on Twitter, and also you can contact me with my work email. So next slide, please. Thank you. Okay, so what do we know about victimisation and older adults? Well, we have a few different sources of data which tell us different things really about the extent, nature and characteristics of different types of crime, violence and abuse against older people. So the first is national data. So typically we rely on the Crime Survey for England and Wales, which used to be called the British Crime Survey. It's exactly the same thing, but just rebranded. And that is an annual survey of around 35,000 people each year. It collects data on previous year experiences of different types of behaviours which would be classed as criminal. So it includes property crime, personal crime, theft, but also violence, domestic violence, sexual violence, stalking. And it's seen as much more reliable than other criminal justice data, for example, police data, because with police data, you have to have actually reported the crime to the police, and subsequently the police have to have recorded it as a crime for it to make the data, the statistics that they will produce. So the Crime Survey doesn't suffer from those same limitations, and so we generally see it as a very reliable indication of previous year and lifetime experiences of different types of crime. So consistently since the Crime Survey was introduced in the early 1990s, it has shown that older adults are generally at lower risk of victimisation across all crime categories. So for example, generally we will find that adults have about 13 to 14% of adults will experience some type of criminal victimisation each year. But for older people, that has been much lower, around 7 or 8%. We can compare that to other age groups, for example, those aged 16 to 24, who generally report around a 20 to 25% experience, 20 to 25%, sorry, of them experience crime each year. So the proportion of older people experiencing crime has tended to be lower, although it's worth noting that in recent years, we've actually seen an increase in older people, older adults reporting that they have experienced some type of crime in the previous year. So recently, the figures actually jumped up to 14%, from 14%, sorry, up to around 23%. So there does seem to be a sort of a steady increase over the last few years of older people who say they have experienced some type of crime in the previous 12 months. Unfortunately, the Crime Survey doesn't provide any further data on the nature of that crime, the characteristics associated with victimisation, and so on. It does collect the data on it, but it doesn't routinely publish it as part of the annual report. It focuses much more on younger people, which is probably the first example of ageism that I'll be, that I can mention in this presentation. Clearly, that is an ageist policy. So we can get data from other sources. So, for example, elder abuse research has existed for the last 20 to 30 years. Most of it is situated within gerontology as a discipline, and so it suffers some of the problems that we've already touched on today in terms of how it sees aging. It's very much a biomedical discipline, and it sees ageing as a problematic condition. And there are several problems with the research around elder abuse, which I'll be touching on in a little bit. But needless to say, at the minute, the most reliable data from the elder abuse discipline suggests that around 1 in 6 older adults will experience some kind of abuse each year. Mostly that tends to occur in the victim's home. Mostly it's a family member or a partner. So it would come within our definitions of domestic violence in most cases. And that would equate to around 2 million adults in the UK each year. So although older people, it would appear, experience crime and victimisation at lower levels than younger people, we are seeing increases, and certainly for interpersonal abuse, so family abuse and abuse by partners, there appears to be a significant number of older people experiencing that each year. Next slide, please. So there have been increasing concerns about the way in which the criminal justice system responds to older victims of crime. First of all, there have been a number of small studies in the last few years that have indicated that there are lower conviction and prosecution rates for crimes where the adult is aged over 60. Certainly an inspection by HMRC FRS a couple of years ago found that there were significant problems with the policing response to victims when they were over the age of 60. And a study by Brown and Gordon in Northern Ireland has recently shown that there are problems with criminal justice outcomes where the adult is older. And these tend to centre around, as I said, low prosecution and conviction outcomes, but also concerns that actually when an older person reports crime, it's diverted away from the criminal justice system. It tends to be seen more as a safeguarding or a social work issue, and so it goes down a different pathway rather than taking a criminal justice route. And similarly, concerns have been raised in the literature so far that policies and procedures that have been designed to support victims in the criminal justice process don't necessarily capture the needs of older people. They've been designed around younger adults and younger adults as both victims and defenders, actually. And so we're not particularly well equipped to deal with older adults when they enter the criminal justice system. And so next slide, please. That has led to widespread calls for a change in the law to address these issues. And there are two main recommendations that are made by campaign groups and lobbyists at the moment, and that is that we introduce either a criminal or a set of criminal offences to capture elder abuse. So these would be very specific offences that made one or more types of elder abuse a criminal offence, and or that we extend our hate crime legislation framework to include age, because at the moment it doesn't include age in any of the countries within the UK. So we have race and disability and sexuality and so on included, but we don't currently have age. Next slide, please. So I've, as you can see, there are 3 calls here and sort of 3 reviews that are ongoing that I've just signposted. So at the moment, the Northern Ireland hate crime review has just sort of come to its conclusion and recommendations. They've been assessing whether or not we should extend hate crime to include age. A similar one is ongoing still in the English and Welsh context. So the Law Commission are currently looking at whether we should add age to hate crime. And similarly in Scotland, they've been looking at this, as well as whether a new offence of elder abuse is needed. And that's where my presentation begins, really, in terms of my key arguments, because I was tasked by the Scottish Parliament to assess the evidence for either a criminal offence of elder abuse or an extension of the hate crime legislation to include age, to capture crimes against older people better, and also to address some of those issues that I've just mentioned around prosecution and convictions and diversions away from the criminal justice system. So I'll talk you through what some of the main arguments are for introducing one or both of these, and also why I feel that they won't ultimately address the main goals, which is to increase prosecutions and convictions, and also to improve responses to older victims. So next slide, please. The first place, though, to start before I move on to some of the substantive arguments is that if we want to address elder abuse, we have to have some kind of agreement about what elder abuse is. And actually, we don't have that as it currently stands. So the term elder abuse is not a statutory one. It's actually not an official term that is used at all, really, in the UK. It's creeped over from America, where it has been introduced and used for some sort of 30, 40 years. Although actually the people who championed the use of elder abuse as a term over there are now actually criticising it themselves for various reasons. So first of all, there is no consistent agreement about what elder abuse means. Some people will use it to mean abuse by a family member or a partner where a victim is over a certain age. Others will use it to describe institutional or care home abuse. Sometimes it will be used actually to incorporate any type of victimization of older people in any context. So that would include a random theft on the street, for example. So nothing that is specific to being older necessarily, but the victim happens to be over a certain age. And so the lack of an agreed definition means that, first of all, it's pretty difficult for us to draw any meaningful data from the studies that have been done on elder abuse, because they all look at very different things, but use the term to mean different things, but use it in a way that that suggests there is consistency in terms of our understanding of elder abuse, when, as I've said, there isn't. But also it means that actually, if you're going to develop any type of law, your first problem is going to be that we don't actually have an agreed definition for what elder abuse actually is. So how could you introduce an offence to capture elder abuse when none of us necessarily have a unified understanding of what the term actually means? But there are concerns with introducing a term, so we could just add the term to our statutory books and provide a definition of it. But there are wider problems with the way in which elder abuse has emerged that mean that that probably isn't the right way to go. For example, first of all, there's arguments that using the term elder abuse obscures the reality of what is actually domestic violence in later life. In most cases, elder abuse research suggests that perpetrators are by and large family members or partners. And so in which case we're really talking about domestic violence, and there doesn't seem to be a good reason for calling it something different simply because the person has reached a certain age, which may be 55, 60, 65 or 70 plus, depending on which study you look at or which policy you read. So what is the benefit in labeling something differently just because the victim is now 60, when a year ago when they were 59 we would have called it something very different? And that has problems because it obscures what we're talking about potentially, but it also focuses our attention on the age of the victim as if that is the cause of the problem or is at the root of how we should be responding to it. And in doing that, you potentially victim blame, but you also remove some of the other important lenses that we've applied to understanding family violence, in particular, examining the difference between gender, power and relations. That is completely obscured when we use the term elder abuse. It suggests that the issue is one of age, and therefore by addressing aging problems, we might be able to address elder abuse, and it carries with it connotations of caregiver stress and older people being a burden, and that elder abuse is something that happens because of that, which we know is actually not supported now by any of the research. And so really it's become a bit of a meaningless term, despite the fact that it is unfortunately increasingly used within informal policy contexts. And so the starting point really is that we wouldn't be able to introduce any law to capture elder abuse as it stands because there are so many problems with it and we don't actually have any agreement of what it is. Next slide, please. Okay, so nevertheless, despite those sort of conceptual issues, there are a number of arguments for introducing a criminal offence of elder abuse and or extending the hate crime legislation. So one of the sort of categories of the arguments for introducing something is that it will provide some symbolic benefits, that it will send a message that abuse or victimisation generally of older people is a serious issue and that we take it seriously, and that older people are valued and that they are a priority and we're giving them that political support. You know, we're kind of identifying them politically as an important group, and that by having these specific laws, we will deter offending through the additional penalties potentially that would be attached to those laws. But there are a number of problems, I think, with making these arguments. First of all, I'm not sure that introducing the law, I think this overstates the benefit of the law. So yes, sometimes the law can have some symbolic benefits because it draws attention to particular issues and it makes a stand by saying that they will not be tolerated. But in reality, that doesn't actually tend to lead us to an increase in prosecutions or convictions. And that is one of the key arguments or one of the key goals of people who are advocating for the change in the law. So I can give you a very recent example of forced marriage, and that was made a specific criminal offence in England, Wales, and also in Scotland a few years ago. And the latest statistics indicate that there has been a 47% increase in cases that have been dealt with by the forced marriage unit. But actually, there have only been 2 convictions in the last 6 years since the law was introduced in England, and none in Scotland. So simply introducing new law may well have raised awareness of the issue, but it hasn't led to an increase in convictions and prosecutions. And if that is one of your goals, then actually the law is not necessarily the best thing, the best tool to do that. You have other means of achieving that. But also, actually, you might undermine your efforts by separating elder abuse off from other types of abuse and saying that should be a standalone crime, because of the reasons I've already identified with the term elder abuse in the previous slide. You potentially actually undermine your efforts because you are separating elder abuse off from other types of abuse and saying that this is a very specific issue. And if symbolically you are trying to send the message that older people are valued and that they are important and are given priority, and then you introduce a law that isn't used or fails to get many convictions or prosecutions, you potentially will send the very opposite message, that older people aren't valued. And actually you will lend support to people who argue that old age abuse of older people doesn't really happen, or if it does happen, it's because of caregiver stress and whatever else. It's a sort of a social issue and not a legal one. So if you introduce laws that aren't used, it's not only bad law, but it actually potentially undermines the very goals that you are trying to achieve by introducing it. And as I said, I think there are other ways of achieving symbolic benefits that don't actually require a new offence of either elder abuse or hate crime. And it's worth, next slide, please. It's worth looking at how other jurisdictions have dealt with these issues and whether or not introducing law has made any difference in those jurisdictions. So in America, they are much further ahead of us in terms of looking at issues of elder abuse in quotation marks or age related hate crime. In relation to elder abuse, they've introduced legislation in pretty much all states, and most of them now also have added age to the hate crime framework. But these are not particularly well used. So the elder abuse crimes generally are not prosecuted, and they are instead prosecutors and the police rely on the more general offences of, say, theft, rape, murder, assault. They don't tend to use the specific elder abuse legislation very often. One, because there isn't a lot of training around it, and two, because in most cases they can't see any need for it. The abuses and the violences and the victimisation of older people are already captured by those more general offences over in the States as they are here. We have no age-specific cutoff for prosecuting theft or assault or abuse. So there is no need for us to create a new law. It just duplicates those existing ones, but puts an additional label of elder on it. And so in most cases in the US, they're not being used. And that's the same with hate crime as well. So several have introduced hate crime legislation that includes older age. New York and Florida have published reports recently which show that in the last year there have been no reports whatsoever of age-related hate crime, and therefore there have been no prosecutions or convictions. So even in other countries that are ahead of us in terms of introducing these, they're not actually being used. And I think that's because of some of the reasons I've already outlined, and some of those that I'll go on to discuss very briefly now. Next slide, please. So the other argument that is frequently raised for introducing either the elder abuse offence or the hate crime extension is that it will help protect our vulnerable older victim. And we've already heard from Louise and some of the other panellists today that actually there are huge problems stereotyping older people as inherently vulnerable and seeing age as a process of decay and decline and deterioration. And that's very much the position that elder abuse takes. It sees older people as that inherently vulnerable being, and that aging is a vulnerable condition. And so the arguments really centre on the need to protect that inherent vulnerability by introducing one or more laws. So the arguments follow that older people are routinely targeted because they're older, they're more likely to suffer adverse effects from crime if they are victimised, and that age-related conditions leave older people more vulnerable to victimisation. But actually all three of these are poorly supported, or the evidence is pretty weak for them. So first of all, the national data shows us that older people are not routinely targeted because they are vulnerable, and that generally older people experience crime at significantly lower levels than other age groups. There is some evidence that older people may experience certain types of crime more often. So for example, doorstep scams, you might find that older people are more likely to experience those in other age groups, but that's not necessarily in relation to their age, but perhaps more their lifestyle and the fact that they're likely to be home and answering the door pre-COVID anyway. We're now probably all at home a bit more, but pre-COVID, their lifestyle may mean that they are more likely to answer the door and therefore more likely to be involved in those scams. But if you look generally at fraud and other types of scams, so email scam and telephone scam based fraud, which is actually the most common types of fraud, it's overwhelmingly younger people that are victimized. In fact, doorstep scams represent only 5% of all fraud. And so still, in the main, older people are experiencing fraud and scamming far less than younger people are. And that is true of all of the types of crime as well. So we can't say that older people are routinely targeted because they are vulnerable in a way that younger people aren't, because actually they're experiencing it far less. They are more likely to suffer the adverse effects. Again, that is strongly debated. So if you look at the evidence on being the impacts of being a victim of crime, actually younger people report that it affects them as much or often more than older people do. And in fact, lots of evidence suggests that older people have built up resilience over the life course, having dealt with multiple different problems and traumas and things that actually mean that they're able to recover from crime in ways that younger people may not yet be able to do because they haven't developed those coping skills based on life experience. And the final thing, that particular age-related conditions may leave older people more vulnerable to victimisation. And this one may be true in some instances. It tends to be talked about in relation to dementia. The problem, though, is that most victims of crime and most victims of what we would call elder abuse or domestic violence tend to be between the ages of 60 and 74. So we do see that as you age, generally, your victimisation risk decreases quite significantly. And the average onset of dementia is 84. So if the vast majority of older victims are aged 60 to 74, then in fact we don't have the evidence to support the suggestion that the typical older victim has dementia, because quite simply the ages of both of those things don't tally up. And finally, I would just argue that a bit like Louise had said, really, sort of situating older people as inherently vulnerable is problematic in lots of ways that have already been talked about, but it's also very paternalistic and disempowering in terms of their legal position. What will routinely happen when we do this is that we actually strip away older people's rights rather than enhancing them, because, for example, a way of dealing with a vulnerable adult experiencing abuse might be to institutionalize them because it gets them away from the perpetrator, rather than seeing it as, say, domestic violence and dealing with it with our domestic violence policies and legislation. So there are lots of issues. I don't have time to go into more of them, but I mean, I could talk at length about the problems associated with vulnerability in this context. Next slide, please. The other thing is in relation to the hate crime arguments specifically is that we should be addressing age-related hostility. Again, just to briefly say that there is very poor evidence, and actually quite a lot of evidence to the contrary now, that older people are targeted because of a hostility towards older age. So we generally see with our hate crime frameworks that we require it to be based on somebody targeting an individual because of who that individual represents. So it's a hostility towards them because of their race or their ethnicity or their sexuality, that it's a hostility against a community, even though it's an individual who is victimized. We simply don't see that with older people. We don't have any evidence of people targeting an older person because they represent older people in general. In fact, more so, we tend to see sympathy towards older people, although it is often within that paternalistic viewpoint that older people are weak and need protecting and looking after. There simply isn't the evidence that we are hostile to them in general. Recently, a few people have suggested to me that that might have changed with COVID because, for example, we're blaming older people for the need for a lockdown in order to protect them. But actually, I've seen more evidence of hostility towards younger people who are blamed for spreading the infection. So again, it's just simply not true that we have hostility in general to older people because they represent an older community, and therefore it wouldn't fit within our existing hate crime legislation. So to simply tag it on because perhaps older people are vulnerable is contrary to what the purpose of hate crime laws are really for. I've just got 2 slides left. Next slide, please. So the very final argument that's put forward is that we should add.
Sorry to interrupt. We're pushed for time. Can I ask a very quick wind up, because I know I've got one question to ask you. Thank you.
Yeah, sure. So just one more minute then. So first of all, the very final argument is that we should leave no one behind, and therefore we should just simply add age to hate crime legislation, because why not? We've got all the other isms, so we might as well add age. That's really bad law, though. You shouldn't add something just because you can, and you certainly shouldn't do it on some kind of on the basis that you are predicting it may well become an issue at some point in the future. And advancing laws should only be on the basis that there is a need for it. So very finally, my final slide, I recommended several other things instead, and I won't go into detail with those. Those slides will be available, but there is a very lengthy 30-page report which details all of these points in more detail. So should anybody be interested, that can be shared, and I'd be happy to answer questions. Thank you.
Thank you, Hannah. Got a quick question from Bev. Bev?
Yeah, thanks very much. And I really enjoyed that. And I guess a lot of what you were asked to do was based on the available evidence and statistics. You did mention there are other ways of dealing. I mean, there's no doubt, because we hear about it, and you probably hear from every expert today, that there is an issue with specific types of violence and crime against older people. I think what we tend to find is that a lot of older people are very nervous actually about reporting and what you might actually assume is minor crimes, and that won't necessarily show up in the data. I think you didn't quite get your recommendations. I mean, you're not just saying, well, that's it, if the data doesn't actually suggest we do anything about it. You are actually recommending that actually the criminal justice system examines more clearly and gets together, discuss whether they're using the existing laws basically to help older people that are targeted for crime. Have I got that correct? Just to summarise that, it's not just about the data, there is an issue, and you do actually make recommendations on that.
Yeah, absolutely. I mean, all the concerns that are raised around sort of poor prosecution outcomes and not having very good policies for supporting victims are legitimate concerns. But my argument is that the law isn't the right tool to address those concerns, so that actually these issues are primarily procedural. And so what we need is, we're not seeing low prosecutions because we don't have laws we can use. We have laws that work perfectly fine. We have laws on theft, on rape, on murder. They're all well placed to deal with these issues. So the issues for me are beyond the law. And it's more about how we are sort of entrenched and embedded ageism within the criminal justice system and within society. That means we don't see these issues for what they are. We call them elder abuse. We send them down different pathways, and we don't have the right policies and procedures to support older victims in the criminal justice system.
Thank you, Hannah. That makes absolute sense, actually, in terms of what the NPC might actually put into its response to the Law Commission on its consultation. I'd like to move quickly on now to Eddie Lynch. Eddie, a lot of NPC members will already know Eddie. Eddie is the Older People's Commissioner for Northern Ireland. Eddie.
Hi, thanks, Jan. Okay, thank you, Jan. Thanks for the invitation to be part of this conversation today. I'll just maybe start by saying there's quite a lot that I've put in my presentation that has been said up until now. That's always the difficulty when you're the last speaker. So I'll cover the points that I think maybe haven't been covered, and maybe gloss over a few of the other ones that I think they have been already covered in the previous presentations. Just go on to the next slide, please. Just a wee bit of background. The Commissioner for Older People was established in Northern Ireland back in 2011, and it was set up to be an independent champion who safeguards and promotes the interests of older people. So that's my primary role, and I've quite a strong suite of legal powers and duties in this role. I'm the second commissioner. The first one was Claire Keating, who I think some of you will know. I took up post in 2016, and I've just started my second term in June of this year. So it's for a maximum of two terms. So that's just a bit of background to my office. If you just move on to the next screen, please, Jonathan. So I've been asked to speak about COVID or ageism in the year that's in it, and obviously COVID and the pandemic has dominated proceedings this year. And I suppose a couple of questions I pose: one, is COVID ageist, and two, was the response to COVID ageist? The first question is easily answered. I mean, COVID-19 is clearly an ageist virus. The vast majority of victims of COVID have been older people. As of the start of this week, we have just had over 1,000 deaths in Northern Ireland. And you can see from those figures there that the vast majority, 95% of victims here in Northern Ireland, were aged over 60. And actually, it was about 3/4 of victims aged over 75. So it clearly has been an issue that has been targeting older people, this virus. So just move on to the next slide. The question, though, is the bigger question is, was the response to COVID-19 ageist? And I think we've heard a number of speakers already talk about some of the problems that we faced across the UK in dealing with this, and Northern Ireland was no different, unfortunately. We saw in the early stages, unfortunately, the transfer of older people from hospital settings out into care home settings without tests. And that clearly led to outbreaks in some care homes and unfortunately deaths. And that's something that I think a future public inquiry will look very closely at, how that was allowed to happen. We had major problems in the early days to PPE. I liaised in my role as commissioner with all the authorities, the trust, the minister, for many weeks to try to support the care homes who just didn't have a chance of getting PPE because they were up against countries practically in terms of trying to purchase them. So that was a big issue. We weren't prepared for a pandemic like this. We didn't have the equipment in place to provide our frontline workers with the protection that they needed. We also had no testing in the early stages, and this was something that I called for quite a while in my role here, and eventually, despite opposition to that in the early stages, it was agreed that testing would be rolled out to care homes. And then in recent weeks as well, I called for testing to be made more regular for staff, and that was implemented too. The other big issue, which in terms of ageism, looking back on it now, at the time I thought it was incredible, but even looking back, it's even more incredible. The first number of weeks of this pandemic, in Northern Ireland anyway, we weren't including victims in care homes in the official statistics. So despite the fact these were the settings that most people were dying in from COVID, our official statistics weren't recording those deaths. And I thought that was an appalling example of ageism in its most extreme form. And it sent a message that, you know, the people in care homes' lives weren't equal to people outside of it. And I thought that was appalling, and something that I was very vocal about in public, and it was then changed. We have also heard about the issue about do not resuscitate. Again, that's been an issue that has been of concern. Throughout this pandemic, I've actually been working with organisations across the UK. I've linked up on an almost weekly basis with the likes of the Welsh Commissioner, but also the likes of Age UK, Scotland, Independent Age, and different organisations. And we have issued joint statements on older people's rights and the need to protect their human rights at different times. And one of the big issues that we face now, and probably the biggest issue in the last 2 months that my office has faced, has been the issue of visiting care homes. And it's something that many families have come to me about over the last period of time. And I think, particularly after we had the first lockdown, many families, when they were allowed back to some sort of visiting, were quite shocked by the decline and deterioration of their loved one. And it's clear now there's a lot of evidence that the lack of human contact with your family has really had a big impact on the emotional well-being as well as the physical well-being of people in homes. So I've been working with the authorities to try to resolve that in some respect, but it's a very difficult balancing act. It's you know, there's the human right to protect life, but there's also a human right for family life as well. So there are competing rights here that are very difficult issues, but things that I think have to be looked at. And we have had some experiences of homes managing to introduce safe visiting, but I think there needs to be more of that. And certainly we're still, even with the positive news about the vaccines, we're still facing a very tough and long winter ahead. And I suppose the other impact of COVID-19 has been on I think it has increased the levels of isolation and loneliness among older people in the community. Many particularly those who've had a shield for many months, and even though the shielding hasn't been official now for some time, the increase in infection in the community here has really forced people back to shield, and that's having a major impact on many older people's mental and physical health as well. And it has led to a reduction in key services. We did see a great community response at the beginning of this pandemic, but I am more concerned now going into the winter period when more people are back to work, where more schools are back. There's less of a focus on making sure older people are supported during the winter months. And I think that's something that, I've been calling on different government departments to do more on in the last few weeks. And I've got a very strong sense of, having had many Zoom calls with older people in the last few months, there is a growing sense of being left behind. I think as more society goes back to normal or back to work, there's this sort of sense that, those people most at risk are just being told to shield or just being told to stay at home. And I think we can't underestimate the impact, the negative impact that can have on people as well. So we need to be aware of that when we're designing services and making sure that we support people in the few months ahead. If you just go to the next slide, I'm just going to briefly talk about age and hate crime. Crime is a big issue for older people in Northern Ireland. There's no doubt about that. And the fear of crime that comes with it is a really big issue. And, I've heard what Hannah said in the previous presentation, but there's a real perception here amongst older people that they are targeted quite a lot because of their vulnerability. And that is something that, many older people have felt for a long time. And I think that the point that sometimes isn't made in this issue, it's not just about the numbers, it's about the impact on victims. And the impact on older victims is without doubt much more severe than younger victims and longer lasting. And I know many people, within my own family who have been affected deeply by whether it's a doorstep fraud or a theft. And, I've seen firsthand the impact that has. So there has been a review of hate crime legislation in Northern Ireland. I have been calling for age to be added to that. I do believe that there is something about, as a society, sending out the message that attacks on older people, crimes against older people will not be tolerated. And in fact, more than that, when people are sentenced, that they do get a more severe sentence because of them preying on the vulnerability of their victims. And just this week, the report from Judge Marnan was actually published. And I'm pleased to say that he has recommended to the Justice Minister here that age be added to the categories of hate crime. So that's something that I'm keen to push on with and ensure that the Justice Minister responds to that and brings it in. It's something that older people here, I think, really do need and deserve. Just next slide, please. So finally, the path ahead, in summary, I think this year has been really challenging for all of us who work with and on behalf and advocate for older people. It has been, it has been unprecedented, the challenge that COVID has brought and the impact it's had on our older community. And I think we have to learn some of the lessons. I think COVID has shone a light on some of the ageism that isn't present in society. And I think going ahead, I think what we have to do, we have to use that now to say, look at the failings in the system, look at what needs to change. And we can't put older people down the political agenda as they've been too often in the past. Jonathan, if you just go on to this next slide, please. So I think, as I said, the pandemic has exposed ageism in our society's values. And, you know, I think some things that happened were actual choices, were policy decisions that negatively impacted older people. And I think there was ageism behind some of them. I think, you know, certainly in Northern Ireland, we have witnessed ageist commentary in the media, particularly as this pandemic has gone on and there has been calls around the economy, and we know that's a very serious matter as well that affects people. But I've been appalled by some of the commentary, you know, they're basically downplaying the fact that, well, this virus is killing older people, but the average age of people dying is 82, as if somehow, well, actually we don't need to be doing more to protect these people. I mean, the evidence there from the medics is that the average person dying of COVID in Northern Ireland anyway is dying maybe 10 to 15 years younger than they had maybe, you know, expected to. So that is one of the things that has come out, one of the nasty sides that has come out during this pandemic. And I think we need to tackle that. You know, when we hear it, we need to challenge it as organisations. We need to stand up for the rights of older people at all times, and call ageism out for what it is. And I think it has also highlighted again many of the flaws in our systems. The one good thing is we have a health minister here who now has announced a number of commitments during the last 6 months. Adult safeguarding legislation, Northern Ireland hasn't had that legislation in place like the rest of the UK, and that's been announced now. There have been gaps in social care provision that the pandemic has highlighted that need to be addressed. There needs to be a much better treatment of our health service and our health workers, including terms and conditions. And going forward, that's something that government needs to grapple with. So when this is all over, it was all right standing out on a Thursday night clapping people in the NHS, but those people deserve much more than that going forward. There's many other things that our nurses and health workers and social workers deserve going forward. So I think in conclusion, this has been an exceptionally difficult year. I think it has brought a lot of the challenges facing older people to the fore. And, you know, we've all had a role, and certainly I've found my role has been brought to the fore in a lot of these issues, where people have turned to me to challenge authorities, challenge the system, to try to ensure that older people do have their human rights protected and that ageism doesn't creep into some of the responses to this pandemic. So going forward, I think we've all a role in speaking out on that and supporting older people going forward. So thank you again for the invitation. It's been a very interesting session and happy to take any questions.
Thank you, Eddie. Running a bit out of time. I know Bev's got a question for you. So Bev, if you ask your question of Eddie, and then we're going to go straight to the 2 poll questions, and then we'll come back to questions after that. Thank you. Bev?
Hi, Eddie, sorry, I should have explained I'm campaign officer with the NPC. I should say thank you very much for your presentation, and everything you've highlighted actually is what, you know, our experience in the NPC is of, you know, that what's been happening recently and perhaps over the years. I just want to go back to the issue of attitudes, endemic ageism, informing decisions, and also just actually listening to Hannah. If decisions are made purely on data, is it the way maybe the data is collected and the fact that we're not actually reporting on, you know, I'm doing enough investigation into what's happening with older people and the types of crimes and, you know, how they're being handled? Because obviously she can only look at the data she's got, but you know, as you said, our experience is basically stuff is happening out there. What can we do about that?
Yeah, there is, Bev, lots of issues around data collection in Northern Ireland. Particularly, it has been an issue in terms of crime and policing. We have seen across government as well, many government departments not collecting data once people reach pension age, for example. So some of the issues, you know, we have employment issues. Sometimes they don't gather that information about over 65s, many of whom are continuing to work and have to work, and with pension age increasing. So I think that is an issue. I think in crime specifically, I know, and I've known for many years, I've been 12 years working in this sector, and I know that there are many, many crimes that older people experience that they don't report because they just, you know, they claim that they know other people who have suffered burglaries and theft and different things. And, you know, because the outcomes have been so low, and this is something that, you know, my predecessor and myself challenged the police on, why are the outcomes of older people so low? Then older people see that and think, well, it's not worth the hassle of going through this, and I'm actually going to cause myself more stress going through this process. And actually, I published a report last year, which looked at the criminal justice system, and actually highlighted a number of things in the justice system itself that made it more difficult for older people to give evidence and to be supported throughout that. So I think that definitely has a knock-on effect on the number of crimes that are reported. But for me, the big thing is, as I said, is the impact on older people. You know, that is without doubt a major issue. And it is something that I have to say now, we've done some good work with the police on that. We've introduced a few extra schemes around extra support for people in the immediate aftermath of a crime and stuff like that. So it's something that's got up the agenda a bit, but I think older people do need to see publicly that commitment. And I've had a few, you know, in this job, I'm lucky enough that I get good access to ministers and I've had a good access to judges in the last couple of years speaking on these issues. And, you know, that has been really useful. And actually, they have been pretty surprised at some of the stuff that I've said to them. You know, and you know, even things like sentencing, where they would have said, oh, I think that's a harsh sentence. And I would be like, I think if you get a room of 100 older people, that you'll have a different opinion there. So it's challenging the system, and but it is sending out that message. And I think the messaging is very important here as well. And one of the things I was planning to do before COVID struck was do some research with actually offenders who you know, offenders who have committed crimes against older people, because I think we do need to do more research in this area and to see what motivates them and what drives them.
Thank you, Eddie. That was absolutely brilliant. I'm going to ask Jonathan now to move to, we've got two poll questions that we'd like the audience to vote on. So Jonathan's going to put them up on the screen and explain how we do things.
Okie doke. So just in front of you now, you should see a poll in progress. It's not as well articulated as our panelists have put it, but please read the question. Is it time to make hate crimes against older people a specific crime, or should a crime be a crime regardless of age? So if you, we'll just give you a minute or so just to have a vote, and then we'll move on to the second poll. Okay, let's end that there. So you should see in front of you, it was a victory for crime is a crime regardless of age. And I will just go on to the next poll for you. Which is whether the government should appoint a commissioner for older people in England and bring all the commissioners from all the nations together for an inquiry into ageism and hate crime.
You trying to give me more work, Jonathan?
Try my hardest.
We know you. You know we love you, Eddie.
Okay, and we'll just end that there. And as you can see, 93%. So yes, definitely trying to give you some extra work, Eddie.
Thanks.
No worries.
Thank you, everybody, for taking part in that. It also gives the NPC a huge load of work to do because the argument to get a commissioner for older people in England is not an easy one, particularly with this government in place. But we will continue to do everything that we can to make that possible. Okay, we've run out of time as usual, but I'd like to just ask a few questions that have come in through the chat. How do you see, it is for anyone who wants to answer, so just, indicate you want to answer. How do you see the role of Health Watch in monitoring? Now, I'm not sure whether Health Watch is right across the UK. I know it's in England. So those English presenters, if you know about Health Watch, is there a role for Health Watch in monitoring ageism, hate crime, all that kind of thing, particularly in the realms of health? Anyone want to answer that? No takers, right? Well,
I would.
Yeah, you
I
won't,
can very briefly just say that
Yeah.
I think we need to again separate out what we're talking about here, because if we say that hate crime exists against older people, then we can introduce ways of measuring it and monitoring it. But of course, my argument is that it doesn't really exist. Ageism exists, but that is not the same as hate crime. And so you can't monitor something which doesn't exist. So yes, there is a place definitely, I think, for Health Watch in relation to ageism, but not hate crime, because there is no hate crime.
Thank you. That's clear. It's also how they also monitor the current situation, because they oversee services to care providers. So we'll see that. There is a thing around the reporting of abuse. We know that, as has been said, there's a cutoff of age 74 around the domestic violence reporting. And again, it does come down to older people feeling confident about reporting such things. It's how we get a way around that. So thank you. I have a specific question from our Women's Working Party. The NPC has a lot of working parties, and we have a Women's Working Party who've made a submission to us to include in the NPC submission to the Law Commission consultation. And they are concerned about the harassment and violence against women in particular. Now, women are not a characteristic in the current legislation, and that they're asking that this should be included in hate crime laws. We've got no problem with that. That is absolutely fine. However, there's a party member, well known to us, Janet Shapiro, and what she's saying is, should we be raising the emancipation of older women, providing refugees more secure income, rather than asking for a new hate crime for older women? Do the panel agree? So that is a little bit of contradictory thing there. So should there be, more awareness raising of older women, the provision of refugees, and a more secure income, rather than having a hate crime, a law for age crime? So I'm gonna just pick, I think we've lost Louise, and we've lost Louise. Holly, are you still with us? Holly?
I am.
Yeah.
Brilliant.
What do you think about that question? It's kind of contradictory to
so Amnesty hasn't done a research piece specifically on older people and hate crime. And our method is that we tend to try to avoid taking positions on things where we haven't done independent research. But I think that the presentations from others were really compelling, and especially, I guess, just to give a personal comment, I think that Hannah made a really compelling argument around things that I hadn't looked at before. So yeah, I guess that's a more personal view.
Yeah, okay, thank you. There is an issue about how we make decision makers accountable for the devastation of what happened in care homes and the thousands of deaths of older people. And every one of those has, you know, an impact on someone in their family or someone that they know. And if they have no family, then at least an impact in the care homes and the people that provide that care. And I think we want to make sure that we can, out of the investigation, independent inquiry that we've asked for, is to get that accountability. I mean, the Prime Minister did say sorry in the House of Commons a couple of months ago, but it wasn't said with any compassion. And obviously the decisions they've made since have shown that that actually didn't mean anything. So I think, again, it's about working together to make sure that that comes out in one of the outcomes that we wish to see from an independent inquiry. Okay. Now, just to close off, I want to come to each of the panel members that are left and ask one question. Where do we go now? And do you have a kind of final comment that you want to make? So I will go to Holly, since you're on screen. Can I ask you to do that first?
Yeah, so I firstly want to say thank you so much for all of your interest in the report. And I think for that question of where we go next, it's around carrying on the campaign for a proper public inquiry, continuing to monitor and call out where we do see evidence around misuse of things like DNARs or denial of access to treatment from GPs, all of that kind of thing. In terms of specific actions to take, Amnesty had a model motion for trade unionists, which if any of you are involved in trade unions, then please do get that passed at your branches. I can speak to Jan or someone about getting it sent around. And yeah, I also think something that Amnesty reflects on a lot in almost all the reports we do across the world is that representative organisations of rights holders are absolutely vital for calling out rights abuses when they're happening and bringing them to attention of other authorities. So I think carrying on like being active members of these kinds of organisations is really, really important. And I think also I noticed a question in the chat about, you know, it's all very good to call out these abuses, but how do we enforce stuff against them? I think it is a shame that the representative from the EHRC has had to jump off, because obviously in the UK, the Equality and Human Rights Commission is an enforcement body that have certain legal powers around that. And really, I think we should all absolutely be questioning them as much as possible around what they're doing with their enforcement powers.
Thanks, Holly. We can send that question to Jackie and we'll get a response and circulate it. I come next to Hannah. Any kind of last minute comments you want to make on the way forward, how we can move forward with some of the things that you've done?
Yeah, I mean, for the particular areas that I'm interested in, you know, as I said at the beginning, I think there are legitimate concerns. Ageism definitely exists, and we see that in some of our responses in the criminal justice system. I would question some of the other claims that are made about, you know, kind of older people as victims of crime, but certainly we have a lot of issues that we need to address, and ageism is entrenched in our ways of working and our views in society, and the criminal justice system is no different in that regard. However, I still firmly believe that simply introducing new law will not address those issues, that we have to think. It's a very popular thing to do, but particularly politically, because you can be seen to have done something about the problem. But just because you can do something doesn't mean you should. And in fact, you should be doing the right thing to address the particular concerns that you have. And for me, the recommendations that I've made are a starting point for that. I think we have to look much more critically actually about how we address age and ageism in general, in terms of our data collection, in terms of our criminal justice responses, in terms of the outcomes that we see in the process. But that, as I said, requires working around those problems in a way that isn't simply about introducing more law to try and fix them, because I think they go beyond that personally.
Thank you. And Eddie, I hope you forgive us for giving you more work, but do you have a comment that you want
Can I just ask Hannah one quick question? I'm just interested what her view would be in relation to the disability category in hate crimes, because I would see older people very similar to the disability, that it may not be people targeting people with disabilities because they hate people with disabilities, but they're targeting them because of their vulnerability. And that's where I would see crimes against older people fitting into a similar category.
You're absolutely right, because when we looked at it, and we've been looking at it with our LGBT group as well, and it is quite clear that, as we know from the statistics given, older people do spend a lot of their retirement with disabilities and ill health, but you can also get a disability in your working life. It could be through an accident, or you do get some kind of condition that debilitates you. And I think that is a difficulty, isn't it? My own personal view is that we're people first, yeah, and then whatever defines us comes after. But as a person, whatever category you tend to be in, the Law Commission should be looking at protecting everybody. So it's not a question of age or disability or anything else. Every single person in the country is entitled to be protected. That won't go down well with the Law Commission, but we'll give it a go. So do you want to round up today?
Yeah, thanks for the invitation. It's been a very interesting conversation. I think I was keen to do it because I think the issue of ageism, as I've said, has come to the fore this year in a number of ways. And I do think going forward that we need to build on the learning that there's been, where we've seen flaws in the system. We have to work harder to fix them. And I suppose my focus, whilst I've been supportive of calls for inquiries, my focus this year has been on the here and now. We're still in the middle of this, and I know from personal experience in public inquiries, they take many years, and those sort of inquiries are not any use to somebody at risk in a care home or in the community now. And my focus has been working with authorities to try to reduce the negative impact on older people, to try to get things done, changes to policies, changes to practice, very practical stuff, helping out families. And I think we still have to do that the next 3 to 4 months. Even if these vaccines go great, we still have a few months to try to get people to the other side of this and try to save as many lives as possible. So to me, that's the immediate focus. But going forward, we need to learn the lessons and build a better system for older people to live in going forward.
Yeah, thank you, Eddie. And I think that brings out the essence of what the NPC tries to do. I think what we are about is making sure that everything that we can do that makes it possible for older people to lead a better life, and that we're not all going on 3 holidays a year with saga and bungee jumping. We're not all in wheelchairs. We're not all, stuck at home feeling sorry for ourselves. There's a whole wealth of difference in, each age group. You've got some very ill and very poorly 60-year-olds. You've got some very sprightly 80, 90-year-olds, like the lady that we heard about, today, who's fighting and arguing for her rights, and good on her. I think that is everything. I want to give Jonathan a last opportunity to explain to people what happens to the slides, and the fact that we'll be sending out a survey from this session. So Jonathan, do you want to explain what happens with the rest of everything?
Okay, so all of the slides will be put on our website, and I'll send a link around to all of our affiliates. I'll also send a link to you all with a quick survey and about how you thought the webinar went, and that's about it, really. Hope you've enjoyed it.
Okay, thank you. And we will, Jonathan, you can capture the chat and questions, can't you, from today?
Yep.
We'll
Yep.
go through them, and because Jackie had to leave, the really big question around how we look at how the Commission does its intervenes with the law, we'll send her that question and any others that we find. So you might get a question from us, and we will then circulate the outcome of that. So all that remains to me to say now is thank you to everybody, all our panel members, Holly, Jackie is not here, Louise, who's had to leave, Hannah and Eddie. I want to thank Jonathan and Bev for their absolute support in putting this together. It's not easy to do. I also want to thank all of those that have logged on. And somebody asked a question, how many people? We have a maximum of 100, and it was full in terms of registration. But we know that there are a bigger audience now looking and listening on live through YouTube. And in a couple of days' time, Jonathan will slice off the beginning and the end and send out a link so that you can share it with people that haven't been able to get on. And one of the other things that I'm really, really proud of is Jonathan found a way to put subtitles on. We did have a gremlin in the beginning, but he sorted that out. So thanks very much. It's quite important that those who sign up who have hearing impairments or have difficulty with using hearing aids with this kind of system could at least see. And some of it has been, you know, as usual with subtitles, we get a few strange words coming up and they add to the fun of it all. But it's a first for us, and I'm pleased it's worked. So thank you again, Jonathan. So I'm now going to close this webinar and say to everybody, keep safe and keep well, and have as good a Christmas as we can possibly manage under whatever circumstances we find ourselves in. Currently in Newcastle, I'm in tier 3, so I don't know if I'm going to get Christmas yet. I hope I will, but well done to everybody, and thank you, and we will see you in the future. This is not the last that you'll hear from the NPC.